Upstate Medical University in Syracuse, New York invites you to be the informed patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. The Clark Burn Center at Upstate University Hospital has a new option for helping to relieve pain using virtual reality. Here to tell us about it is Tamara Roberts. She's a nurse and the burn program manager. Welcome back to the Informed Patient, Ms. Roberts.
Thank you for having me.
A $15,000 grant allowed you to purchase 5 virtual reality headsets for pain management and 1 set that has attachments for physical and occupational therapy. Can you walk us through how these work?
They're actually really simple. When you turn on the head device, it will look at your eyes and it gets your gaze. And so then after it's done that, you can use your head to kind of move around and navigate through the system. It can walk you through it, or you can choose to skip it. And then what they do is they get many different options for what type of virtual reality they would like to go into. And all of it's done just by simple movements of the head and eyes.
Now, is this for adults and children?
They are. The sets are all one size, but we do have the ability to adjust the headsets once they are on that individual's head. There's little knobs on the back so that we can adjust it to fit just right.
Would you put these on a patient in bed, or is this for during procedures, or how are these used practically?
It depends. They should always be sitting because obviously when you have virtual reality on, you don't want to fall. So we offer for them to utilize them while they're in bed. Maybe they're preparing to have a dressing change or they're getting ready to go to the operating room and they just want to kind of relax and decrease their anxiety. So we'll allow them to do it in bed. It can also be during procedures. As long as we make sure that the headset is not going to get wet, they can take it right into the procedural room. They're lying on a table. It can be done there, or it can also be done sitting up in a chair.
Are these headsets used instead of or in addition to other pain relief?
This is in addition to. The goal is we really want people to be as comfortable as possible. Obviously, we can't take away all the pain. It's just not something we can do. So we try to utilize alternative modalities, which is just trying to utilize virtual reality, journaling, or using essential oils, meditation, things like that, to kind of help decrease the need of those pain medications, but we're not going to take away the medication.
Have you seen virtual reality effectively distract someone or reduce the amount of pain medicines they need?
We are currently studying this. So what we're doing is we implemented a program and it's basically utilizing what we call the functional pain scale. That is different than our regular numeric pain scale that we use. And the functional pain scale, it doesn't just look at a number. It really looks at how does it affect your ability to move? How is it affecting your rest? And are you able to participate in those daily activities? And it's looking at the person and what they're able to do with the level of pain that they have. We want them to be able to do activities of daily living and be able to do those functional things without having a ton of medication. And so this is a better idea of how do we look at that? How do we look at the pain? How do we treat it?
Can you explain why virtual reality is able to reduce the feelings of pain?
Well, virtual reality, it really is giving you the opportunity to be distracted. And with the VR, it distracts the brain from painful sensations during procedures like dressing changes and therapy. When people are focused on that VR and exploring through nature or playing games, your brain is processing fewer of those pain signals that are being triggered during different procedures.
Do you think it'll work for everyone?
No, it really depends on the person. Some people can do virtual reality and it really helps to distract them. And other ones can't even put the headset on because it may make them dizzy or nauseous and just doesn't provide that distractibility that they're looking for.
So, how does the physical and occupational therapy attachment work? How is that different than just the virtual reality
So,
headset?
for the physical therapy, occupational therapy set, it is not only a headpiece, but it has attachments that go to both upper extremities, both of your legs, and we also have a piece that goes over your chest. And what this does is it's almost like a Wii where you're playing tennis or basketball or you're kicking balls for soccer. So it's actually getting that patient to move their extremities versus virtual reality where you're just kind of immersed into some type of a picture that you're going through. And with the therapy ones and getting people involved with the different games, we have really seen where individuals who couldn't really stretch a lot before because of the pain and anxiety involved in it, when they're immersed into this one for therapy, they were reaching 90% to 100% of their goals because they were just so distracted. And it's just an amazing tool that we have.
This is Upstate's The Informed Patient podcast. I'm your host, Amber Smith, talking with Tamara Roberts, the burn program manager at Upstate University Hospital's Clark Burn Center. Let's talk about the other ways pain is managed for people with burns at the burn center. To start off with, though, why does the burn center try to minimize narcotic use?
There's always risks associated with any type of medication we take. So trying to avoid using too many narcotics also makes sure that we're decreasing that risk of side effects, as well as complications that can be associated with that. When we use a multimodal approach, which is kind of using different types of treatments like your virtual reality, your journaling, or anything like that, it helps to reduce complications during the patient's stay. And it also decreases their length of stay because they're better able to tolerate pain at different levels. And they're learning new techniques on how to decrease pain without using significant amounts of pain medication.
And do you measure pain? You mentioned there's a functional measurement, but also numerical. Do you use both?
We use just the functional pain scale when we are verbalizing with patients. If we were to use two different ones, it could get very confusing. So these patients and families have an education packet at the bedside about functional pain assessment, about alternative modalities to pain, and how to use those. And then those are also reminded at every nursing shift change. They talk to the patients and families about it and what they can do.
How do essential oils work?
Essential oils are almost like your virtual reality. For some people, it works. For some people, it doesn't. But essential oils, we have 3 different ones that have been tested in research to show that they decrease pain and anxiety in patients with burns during dressings and things like that. It's certain smells. So we have little applicators that it's put onto a stick, and then it's put onto a little inhaler that the patient can wave by their nose. And it just really helps to decrease that anxiety that a patient may be having and help them get back to a state where they can focus maybe on some deep breathing and things like that.
You mentioned journaling before. How does that help?
Journaling is actually very interesting. It's a popular thing that many different people try to utilize. It gives the person an opportunity really to express their feelings in a safe place. It gives them the opportunity to reduce that stress and anxiety because they're putting their thoughts and their feelings on paper. That can sometimes help calm your mind. And then finding strength, it's seeing the words that they wrote and help them recognize the courage, the strength, and the progress that they make each day.
Can you tell us how music therapy is done in the burn unit?
Music therapy is really working with individuals to decide what type of music do they like? Do they have certain songs that help to make them feel calm? For some people, they will have a family make a CD for them that they can play throughout painful procedures and things like that. And they're able to listen to that music and they're focusing on the music rather than what might be going on around them. And again, it really depends on the person if it's something that works for them or if it doesn't. But most often people are willing to at least explore that option. And we also have music therapists that will come by and visit with our patients as well. And some of the people really enjoy that.
Is meditation or guided imagery used on the burn unit?
We have both opportunities with the meditation, with the packet that is given to patients and families at the bedside. There are QR codes that they can scan either with the iPad that we have at the bedside for them or their phone, and it actually will take them through meditation and allow them to practice it. And then we also have the opportunity for guided imagery where one of our chaplains is trained in guided imagery and they will come in and they will kind of teach them how to do it. Meditation is more of a passive, like observation type thing, while using the guided imagery, that's more of an active mental visualization because it allows them to focus, set goals, relieve pain, and really stimulate that healing process in the body by using that guided imagery.
How effective has Reiki been?
It has actually worked really well for some of our patients during painful procedures or even post-procedural. We have our individuals who are trained in Reiki, and if it's being performed, the patients have said that it really has helped to decrease their pain levels. So they may have Reiki a couple times a day if it's helping to decrease their pain. Again, it has to be something that works for that person, because every single person is different and how they're feeling pain and how they're able to cope and manage with pain. Because again, I just want to say that burn injuries are some of the most painful injuries that a person could ever endure because your skin is the largest organ in your body. And when our skin surface is interrupted, all of our nerves are now exposed. So all of those nerve endings are just jumping all around saying, this is painful, this is painful. And so it's just something that I like to make sure people really recognize how painful it can be.
It's good that you have such a variety of things to offer as options that might help different people. Let me ask you, is pain typically under control before someone is discharged? Or do you have patients who end up making use of some of these techniques once they go home?
Most often when people go home, the pain is not gone, but it is certainly at a decreased level because when they're being discharged, they have already probably had their surgical procedures done. And so they have either some type of protective cover over those injuries and they're starting to heal, but they still have pain. So they do go home with pain medications if required, but they have to be at a level that's tolerable. We can't just send them home if their pain is intolerable. But we encourage people to take all of those tools that we've taught them throughout their stay to continue to use them throughout the rest of their recovery and for the rest of their lives.
Well, thank you for taking time to tell us about pain relief, Miss Roberts.
You are more than welcome.
My guest has been Burn Program Manager Nurse Tamara Roberts from the Clark Burn Center at Upstate University Hospital. The Informed Patient is a podcast covering health, science, and medicine, brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe, with sound engineering by Bill Brokel and graphic design by Dan Cameron. Find our archive of previous episodes at upstate.edu/informed. If you enjoyed this episode, please invite a friend to listen. You can also rate and review the Informed Patient podcast on Apple Podcasts, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.